If you thought about getting cosmetic surgery, let's be honest here, the guy in your life has probably thought about it too. In fact, Dr. Thompson's here today to tell us the top 5 procedures, cosmetic procedures that men are interested in getting.
Have you thought about any one of these?
I thought about one of them.
We're going into detail now, so take a listen here as Dr. Thompson describes them, and I think the number one won't be shocking to anyone.
Yeah, Botox is the #1 procedure performed, cosmetic procedure performed by far for men and women. And of course, it's a lot lower for men, but still, it's really common for men. And you know, it's something that women, we're usually trying to get rid of the wrinkles completely. For men, we're just trying to soften things and kind of slow the aging process down a little bit. 7
million procedures of Botox in 2015. Is that number just growing now in 2016?
Yeah, I think it will continue to grow. It's very safe. It's proved itself over decades. It works every single time.
And what's the most common spot on men?
I would say for men, probably these squint lines.
I'm seeing them already.
And the scowl lines. And,
right here.
You know, that's where I've actually had my nurses inject me because I just squint a lot and it just kind of softens the lines. And
you can't even tell.
And it just slows the process. And I have a brother who's probably 5 or 6 years younger than me who just looks older just because I've done this a little bit. And you know, men aren't necessarily trying to look younger, but if you can slow it down a little bit,
Okay, but in the break, what did you tell him?
This is the one thing of the top 5 that I would consider doing. And part of the reason is, as I've learned more about it here on this show, it's less invasive than the other ones we will talk about. Plus, I know that it's so easy to get done right now, and I can reduce these wrinkles right in here.
But you
I have these forehead wrinkles.
But you then said, Dr. Thompson, I'll lose my expression.
I'll lose my comic expressiveness.
Does that happen?
Everyone is always worried about having a frozen face. And, you know, Botox just has to be done judiciously. And it can happen, but if it's done judiciously, it just softens the look, but you still have all your facial expressions. And you're absolutely right. It's very easy. It's low risk. There's no downtime. You can just do it and, you know, go right back to work. You might get a tiny little bruise, and it's a great procedure.
Because as a millennial, you know, you want to be able to, I don't want to admit that I'm getting wrinkles here.
He's so young. Let's talk about number 2 now, and this one is growing for men. 30% of the procedure you do with this, the eyelid surgery, is men.
Yeah, so eyelid surgery is probably disproportionately common for men just because we have a lower eyebrow. And so because of that, it starts to get full and baggy sooner, and it actually starts to block our vision sooner. And so it's a great procedure for men. Oftentimes insurance will cover it because it's blocking vision. So
I thought this was a picture of my husband for a second.
It happens sooner for men than for women.
It's not my husband. He did have it done, though, several months ago, and I can't tell you how much better he just sees.
Yeah, it's a huge thing just for vision. Most men that come in are not doing it necessarily for a cosmetic purpose. They do think they look tired, but it's functional. They can see better once it's done. So.
I see this third one here surprises me because I would think that women would be more inclined for this one than guys, but apparently that's not the case.
So rhinoplasty, is that the third thing we're talking about? So rhinoplasty is common for men just purely because we're more likely to have history of broken noses and trauma and crooked noses. So I do a lot of procedures to straighten noses, to fix breathing, and then a lot of times they'll say, well, you know, I hate how my nose is hooked, or I hate this bump, and so a lot of times it's a combination of the two. So
I inherited this bump from my mom's side of the family.
Gives you character.
Yeah, you don't have much of a bump. Yours got a great nose. So.
Earlier on the show we talked about tech neck, everyone getting the wrinkles from looking down at your phone. Would the next procedure help you with that?
Probably would help with that, yeah. So the next thing we're talking about is Kybella, which is now I think FDA approved for 2 years or so, and it's an injection right under the chin to get rid of just that excess fat that's hard to get rid of even with weight loss. We can do it surgically, but Kybella is a non-surgical option, and several of my staff members in my office have done it, and even people like Jenny, who doesn't have much, but it's just kind of lifted that up, and it's made a nice difference for her.
And the last one's hair transplants, and this makes sense for a lot of guys out there. We don't want to lose what we've got on top here, but so we've got to go out and find ways to get it done. You can take care of that.
Yeah, and there are multiple ways to do this. This has really come a long way over the last several decades. It used to be something that was obvious when someone had had a hair transplant. Now we have methods where we can actually extract each individual hair from the back and move it to the front, and it's impossible to tell you had anything done. It makes a huge difference in the initial impression you get when you look at someone's face if it's framed by some hair.
I like that it's subtle. The before and afters you showed were subtle. If you've been thinking about doing any of these procedures, Dr. Scott Thompson is the guy to do it. He really is incredible. He's at Utah Facial Plastics. That is the website. We will link you from ours. And right now they're doing a little Botox deal, so don't forget to go to their website to find out all about that. Thank you, Dr. T.
Thank you. It's
Thanks,
always
Dr.
good
Thompson.
to be here. Thank you.
As always. All right, and coming up here on Good Things Utah, a lot more still ahead for us. We're talking about all sorts of things.
We're doing it wrong. Something Brian's
Something,
going to tell
we'll
you.
hit you.
We're
We'll hit
doing
you
it
up on
wrong.
that.
We'll be right back.
Painting for Good Things Utah, provided by Xavier